Today I will talk about the prevention and treatment of postmenopausal osteoporosis. So when we talk about osteoporosis, when we talk about menopause, we may aware about the osteoporosis because this is a hypoestrogenism stage, right? The first primary prevention is we need to screen all the risk factor. For example, like the female more common to become osteoporosis, all the age and Caucasian race. Then, if any history of fragility fraction previously, even also heart risk, hereditary, maybe we can ask the first degree relationship lah, or like mother when is it any risk of osteoporosis. Okay, at the same time, low weight also, if weight less than 57 kilo, meaning 50 kilo and below, at associated risk also. Okay, right, at the same time hormone, and then delay menarche, and then early menopause is a can cause, and how hypoestrogenism syndrome, like Turner syndromes. Right, smoking and poor nutrition, malnutrition because lack of calciums, heavy alcohol because it can lead to malabsorption. Okay, and then reduce the bone density also, the alcohol itself. Okay, and then any increase of risk of falls, for example, like the floor very slippery or inadequate lighting, poor vision, hearing imbalance, that can lead all the falls. Okay, about the past medical history, there is all the issue that related with bone, like rheumatoid arthritis, organ transplantation, because we on immunosuppression, which can lead the bone suppress also. Okay, all the depression drug. Hypoparathyroidism, because as we know, it's a parathyroidism is a hormone that maintain the bone remodeling also. And Cushing syndromes, hypothyroidisms, and malabsorption, and multiple myeloma. Right, diabetic one I'm not sure. And about the medication, like all the chemotherapy, because there is a myelodepression punya drug can cause lead to the bone deform also. Okay, aromatase inhibitor, GnRH, all this one is a lead to hypoestrogenism stage. Okay, anti-epileptic drug and glucocorticoid and lithiums. Alright, okay, so by general examination, just it's unremarkable unless there is a patient may complain pain or fracture. Okay, the best is a scan, the DEXA scan lah, to determine is it a patient on osteoporosis or FRAX score calculator. Right, so FRAX is based on the risk factor. Okay, about the DEXA scan, is the primary diagnostic tool. Is a diagnostic tools for determine whether the patient on osteoporosis or not, which mean we relate with the T score. T score less than negative 2.45, that is associated with the osteoporosis, and less than negative 2, more than negative 2 means it's a osteopenia only. Right, okay. In term of management of osteoporosis, first is a prevention. How we prevent is better than treatment. Okay, prevent like lifestyle modification. We try to prevent any things that can cause you precipitate to falls. Okay, for like example, sleeping, vision, hearing imbalance, that's what issue. And then modify all the medication, modify the medication. And physical activity shows increase bone density, improve strength, balance, and agility, especially when the weight bearing exercise, it increase the bone density. Okay, and avoid smoking, reduce the alcohol consumption. Dietitian, when we talk dietitian, we think about vitamin D and calcium. Okay, so recommended by NICE is about 1000 milligram per day for calcium, and vitamin D is about 800 unit per day. Right, but so maybe we can take from our diet, so like dairy products. Okay, like milk, yogurts, right? Fish also can also increase. There is a lot of calcium. Okay, when we talk about the pharmacological, we thought it's about prevention and treatment. However, there is a may benefit in the HRT, but HRT is a design for early menopause, means premature menopause. Right, premature menopause defined is a which one in menopause less than 14 years old, 40 years old, 40 years old. Okay, so in terms of that, because of WHI trial shows there's a benefit of HRT in term of to reduce risk of osteoporosis. However, there is not purpose for bone protection, because in the nice guideline in the UK, they practice HRT in the women who had climateric symptoms only, because they afraid the risk of CA, breast CA, venous thromboembolism. If patient is a warrant for HRT, we may continue up to 15 years old, and we assess any risk of any CA risk. Okay, any CA, if don't have any CA, we may continue up to 16 years old, right? So that's about the prevention, okay, not the treatment. Okay, but when we talk about treatment, we must think about the biphosphate first. Is the role of biphosphate. So because it inhibit remodulation of the bone, and then biphosphate we available in our hospital is a Fosamax, or for example is Fosamax. Okay, so it shows benefit is a license for osteoporosis treatment, and then it shows is increase the bone marrow density and reduce the osteoporosis. Others, the biphosphate is aldronate, risendronate, and zoledronic acid. Aldronate is the most cheapest one and preferable lah. But it protects up to 5 years. Okay, drug can restart if any evidence of bone loss. Okay, if patient on Fosamax, so we in the guidelines says we recommended to assess the bone marrow density, that's a scan every 2 years, 1 to 2 years. Okay, to assess if still no osteoporosis, we may continue up to 5 years, right? So after that is because we afraid there is a risk of fracture fragility. Okay, how to take the side effect is osteophagus GERD. Okay, osteophagus reflux, that irritation that cause because delay in esophageal emptying. Okay, so during the eating, patient must sit stand up position or upright position. Okay, because they want to gravity down to stomach direct. Okay, absorb, and then it take after 1 hour after meal or before meal. So empty stomach, and then with a lot of water. Okay, right. Oral intake just take after 30 to 60 minute. Right. Parenteral biphosphonate just designed for patient who can't tolerate with the GIT. Okay, so however there is a risk of osteonecrosis jaw. Okay, ONJ. The second treatment is a strontium renalate. It's a reduce the bone resorption, maintain the bone formation. It's a have orally after 2 hour meal, but it's not recommended for patient who had a renal impairment, right? And license for treatment, because in the strontium renalate, what we afraid is a risk of VTE, and then the side effects are dermatitis and diarrhea. Okay, nasal calcitonin or calcitonin. Okay, calcitonin is memang main purpose for treatment of osteoporosis, but less effective than others agent. Okay, because it act only on vertebra but not on vertebra fracture. Okay, calcitonin is can reserve the last resort lah if any treatment was failed. Okay, the side okay, that the nasal calcitonin. Denosumab is a monoclonal antibody direct to RANKL receptor. It inhibit the bone reception by interfere the proliferation and differentiation of osteoclast. It may use in what the best about the denosumab, it can use in patient who had a CKD. Okay, but it reduce at the same time, it reduce the fracture risk of vertebra and non-vertebra. The side effect is a skin infection and ONJ is high. Also, it can lead to hypocalcemia. Once we talk about the others is like anabolic treatment like parathyroid peptide or recombinant human parathyroid and recombinant human parathyroid, or like for example like teriparatide. It reduce the vertebra but not the vertebra fracture but not the non-vertebra fracture. Duration is limited for 24 months only because there is a risk. There is a contraindication patient on renal and liver problems, hypercalcemia, and bone CA. Okay, there's a combination between the benzodiazepine and benzodiazepine. Benzodiazepine is a like SERMs. Okay, SERMs is one of the treatment. It's a raloxifene. For example, it's raloxifene. It's a selective estrogen receptor modulator. Memang it's a purpose for treatment of osteoporosis. They increase the bone marrow density and reduce the fracture. But there is a side effects, VTE and vasomotor symptom. There is a symptom of vasomotor. Dosage is about 60 milligram daily, and then it's a contraindication for patient in premenopause. NICE recommended the secondary prevention to osteoporosis can use in the breast CA woman. That's the best for SERMs, alright? Can use in breast CA woman. Okay, remember. And then, however, another one is a tissue selective estrogen complex, T-sex. Alright, T-sex is shows safety and in the endometrial aplasia less than 1%. Reduce hot flushes and increase the improve the vaginal dryness. Tissue selective estrogen complex, sex. Alright, that's all about the osteoporosis in menopause. Thanks.